Hi, my name is John Nelson, and the purpose of this demonstration is to provide Matrix users an overview on how to use the ODG guidelines, or the Official Disability Guidelines. ODG is the most comprehensive and up-to-date medical treatment and return-to-work guidelines worldwide, providing evidence-based decision support to improve as well as benchmark outcomes in workers' comp, non-occupational disability, and general health insurance. Today, what I really want to focus in on is how to find information in the application, as well as take you through one of the topics and show you the clinical information. And then last but not least, really focus in on the predictive duration calculator located in the toolbox, which helps customize days of disability based on demographics and comorbidities. There is other information in the toolbox, but right now what Matrix wants to focus in on is the predictive duration calculator, the searching, and the return to work time frames. There is a brief description of the toolbox tools here located on the home page. You will notice that upon entering the site, there's a search bar here that works very similar to Google in that you can start typing in a medical condition, a body part, an ICD-9 code, or an ICD-10 code. For example, if you wanted to search for carpal tunnel, you can simply start typing in the word carpal tunnel, and we will predict out to what you're typing. From here, you simply hover over what you're looking for, and it's a point and a click. You could also start typing in rotator cuff tear. And again, you'll see we'll predict out to what you're typing, and you'll click on the condition you're looking for. You could type in the word hip replacement. From here, it's a point and a click. You'll notice that we have both ICD-9 and ICD-10 codes available. So you can also search in here by ICD-9 or ICD-10. So for instance, if you know what the ICD-9 code is, you can simply type it in. Or if you know what the ICD-10 code is, you can simply type it in the search bar as well. If you don't quite know what the condition is or the ICD-9 or 10, you can also do a more broad or generic search by body part. So for instance, you could look up, type in the word knee. And you'll see we'll bring back all the conditions with the word knee in it. You could type in elbow. You could type in the word back. You can also type in, for instance, the word cancer. And when you click on the magnifying glass over here too, it will also bring down a drop-down list. From here, we're simply asking you to point and click, and it will take you into that topic. You'll notice over here to the left-hand side, it will also provide you with a search history. To go back to the home page, simply click on the Peers button here or the back here. You'll also notice top conditions to the left-hand side. These are also quick hyperlinks, so you're welcome if you're looking for these conditions, for instance, pregnancy, you can simply click on that topic and it will bring you right into that page. You'll notice here, we're going to provide you with the name, the ICD-9 code, but you'll notice over here to the right-hand side too, we're going to provide you with both the ICD-9 and the ICD-10. Your search bar will remain on every page, so you're welcome to toggle between information or type in a new condition and so forth. Again, to go back to the home page, simply click on the back arrow or the Peers button, and here we are. So, in quick synopsis, or to recap, to search, you can search by medical condition by typing in the name. You can type in by, excuse me, ICD-10 code. You can search by ICD-9 code or body part, or you can use the top conditions on the left-hand side. Just really quickly, I'd like just to choose back strains and just show you the information upon entering the site. What I'd really like to focus in on once we get to the topic back strains here is upon entering this condition, you're going to see two boxes. What we really want to focus in on is this box B here. For the time being, please do not worry about this box A. We're going to just forget it. Box B is really what we want to use as a case management or a best practice duration. And I really find it very important to start here by saying what you do as the human intervention or the case management portion of this process is by far the most important part of this process. A guideline is simply a guideline. It's simply there to help back the decisions you're making and be used as a framework of dialogue. The human intervention or that portion of the case management process is, again, by far the most important piece. So what you do on a daily basis, again, is really imperative and key. And so you can use these guidelines as a framework of dialogue to communicate common goals and expectations. So again, you'll notice once upon entering into lumbar sprains and strains, you'll see the ICD-9 codes as well as the 10 over here. But you're going to see in a really big box here, it says manage towards the best practice duration. In here, what we're asking you to do as the users is pick the scenario that best describes the patient you're working with. So for instance, the mild and the severe in these scenarios actually deal with the severity of the condition. So right now you'll see it says mild manual heavy work. So what this really means is the person that you're dealing with has mild back strain doing manual heavy work. If they had severe back strain, you simply put your cursor, your mouse over it. If you click on it, it will highlight it, put it into bold, and you'll see the number changes in the time frame B up here for the best practice duration. If you know what type of job the patient is doing, you can hover over the various Department of Labor job classes, and we will filter the scenarios that best describe the job classes. By choosing all classes, you'll see all scenarios. You can also filter by activity level by the arrow keys here or by duration in days. I think you'll notice it usually starts at 0 days, kind of doing more of a clerical, transitional duty, modified work, and working its way down to heavy and manual work. To help support these best practice scenarios or durations that you're going to be using, ODG offers very nice information on capabilities and activity modifications for restricted or modified work as well as for regular work. And this is going to talk about, and they're very specific to the condition, but flexibility, ergonomics, repetitive motion. And so you can use these to help support your the durations here, as well as in your communicatory processes and working towards recovery timeframes and so forth. By scrolling down here a little bit, you'll notice that we're going to offer physical therapy guidelines, as well as chiropractic guidelines, if they're applicable to the condition. And then for the matrix workers' compensation specialists or case managers or nurses, you'll notice here we have a section for treatment. The ODG treatment guidelines have been adopted in many states. You'll notice here to the left-hand side, it's going to cover all treatments in alphabetical order, or you'll notice the alphabet here, and then medications to the right-hand side. If you're looking to see what types of treatments would be recommended or not recommended, you can simply start scrolling down, and it's in alphabetical order, or again, you can simply use here. So if you were looking for MRI, for instance, if you simply click on the M here, it will take you down to MRI, and you click on this. The first few sentences are going to talk about whether it's recommended or not recommended. And then you'll notice that all of these links here actually link into the articles. So if you have some time and you want to understand why those treatments are recommended or not recommended, you can actually link into the articles that cite the literature, the rankings, and the evidence, and so forth. To get to the top of the page, you can simply scroll up or by clicking on the up arrow key here. So I'm just going to kind of do a brief recap here. For Matrix users, we really want to focus in on the time frame B. We're going to ask you to choose the scenario that best describes your patient. So if you have someone with severe back pain doing heavy manual work, you'll simply click on that. You'll notice it will put the duration in days up here, and that's what you'll use as a starting point. The capabilities and activity modifications are there to help support the various different scenarios or the durations. Physical therapy guidelines, chiropractic guidelines, and then again for the workers' compensation users, the treatments and the medications. And again, it's going to be the first few sentences are going to talk about whether it's recommended or not. And then you have the ability to really kind of deep link in to understand the reasoning and the literature and the rankings behind that if you want. Just scrolling up here, I know clinical content is extremely important. So if you have some time and you want to understand a little bit more about the condition, you can click on the Medline Connect button, which will hyperlink you into the U.S. National Library. But here you'll see some static images. You can read more on back injuries, so it gets into diagnosis and tests, treatments and therapies, but there's really good patient education information in here too. So, you can click on this information. Up here you'll see back pain returning to work, for instance. So here's tips to help prevent back pain, learn how to lift properly. And this opens up to an entire library of medicine. So if you wanted to toggle or research another topic, if you want to type in depression, you can simply type in depression. So this is going to provide you with very nice clinical referential information to help support your decision. So if you want to learn a little bit more about the condition, understand what kind of conditions you're dealing with, you can click on that by simply under the clinical content, clicking on Medline Connect, and that will bring you right into the topic of back pain. For some of the other major conditions, we do offer 3D anatomical design. So if you see kind of a visual diagram here, a picture, you'll notice that these are usually about 30-second to a minute clips, but they will give you a nice visualization of what the condition is. For those of you who are better visual learners.
The spinal column are called vertebrae. They are also named for their locations. The cervical vertebrae are in the neck. The thoracic vertebrae are in the upper back. And the lumbar vertebrae are in the lower back. The bones at the bottom of your spinal column, called the sacrum and the coccyx, make up your tailbone. Experiencing back pain usually means you have injured the ligaments or muscles attached to the vertebrae. Common causes include twisting motions, poor posture, and overuse.
Okay, so again, if you want to learn a little bit more about the clinical or the referential information on that condition, we have two options here, the Medline Connect, and for some of the more common conditions, you will see some 3D diagrams. We covered this a little bit before, but when you're in any condition, you'll notice that we'll have the ICD-9 as well as the ICD-10. So we'll provide you with both sets of codes. Under the toolbox, the tool that we really want to focus on is the predictive duration calculator. In this predictive duration calculator, it's going to allow you to customize the days of disability based on, or a return to work time frame based on certain demographics and confounding factors or comorbidities. So for instance, you can put in the state, you can put in the job class, you can put in the person's age, and then we could also say, what if they were obese and a smoker? And as I hit recalculate here, you'll watch this time frame B change. So if you look here, as we're doing the inputs, the output over here is changing, and you can see it added some days to the best practice duration here, the green box that we want to manage towards. What this tool will also allow you to do is if you just click in the box on the ICD diagnosis codes here, you can use it as a search, so you can just search just like we did before, or if you know what the ICD-9 or 10 is, you can simply put it in. And if we click on that here, you'll notice it added durations, and you'll see now it's calculating the expected length of disability for these characteristics and the confounding factors, these demographic characteristics, as well as these conditions. If you wanted to take one out, you can simply click on the X here. If the person did happen to have surgery, for instance, you can also check this box here. You can select the condition. You can select the procedure. Let's say they had an artificial disc put in, and you can recalculate. Again, as the inputs change, the output changes on the best practice duration. So in quick overview, the predictive duration calculator allows you to customize the return to work duration timeframes based on geographics, Department of Labor job class and age, confounding factors, and it will allow you to add in up to 5 diagnosis codes. So this really kind of concludes the short demonstration on how to find information. I'm just going back to the home page now. And again, just in recap for searching is here, the top conditions. For those of you who are more workers' compensation focused, here are the treatment chapters that you can search by body part, and these will give you all the treatment recommendations. I appreciate your time. My contact information is up here. If you have any questions at any time, please feel free to give me a call. Thank you very much. Bye now.